I'd like to go ahead and start the question and answer session of our community lecture series tonight by first just thanking you all for being here with us tonight and for taking the time to join us on YouTube watching the film, as well as here for the Zoom webinar question and answer with our panel of experts who are involved in the making of the vaccination from the misinformation virus, which we just watched, and really enjoyed watching it myself. And I know I was sending it to as many people as I could on my social media, because I know there's many out there who need to hear it. The community lecture series is one of my favorite things at the School of Medicine. I'm Ashley Salazar, by the way, the Chief Advancement and External Relations Officer. And part of the mission of the UNM School of Medicine is to improve the health of all New Mexicans. And the community lecture series is a great way of getting healthcare information and education out to the community that we serve. And so what better way than providing an educational film like this and an opportunity to watch it together, and then to come together with all of you for questions and answers that may be more specific to our lives with the experts here, many of whom we're happy to say are fellow Lobos and right here with us at the University of New Mexico. And so I will take a minute to introduce those panelists who are able to join us today before we move into the question and answer session. So we have with us tonight the producer and director of the Vaccination from the Misinformation Virus, and that's Chris Schuler, who is here and will be asking a couple questions. Thank you so much for being here. Alumnus, a master's program of 1985 at UNM. So happy to have you. We also have Dr. Walter DeHorty, who is here. He's an associate professor of pediatric infectious disease at UNM and also was interviewed. We also have Admiral Pamela Schweitzer, who is the former Assistant Surgeon General, and we're very thankful that you've joined us as well. And then we have Dr. Melvina McCabe, Professor Emeritus and alumni of UNM School of Medicine, 1984, former House staff and former faculty. So a wonderful group of panelists here, Lobos and experts who can help us get through some of these questions. I want to start with the questions that we received, of course, ahead of time through registrations, but I also want to just note to those who are watching the webinar that you can also use the question and answer function of the Zoom webinar to submit any questions that come up while we're in the conversation. We'll be monitoring that as well to make sure that we get those questions in. The first question I'm going to ask is going to be for you, Chris, and it is, we had somebody comment about the underwriters for the film. The Mexico Hospital Association is one, and this individual just commented about how great it is that we're hosting the event and how important it is to get the information out there. And so we thought it would be nice to hear a little from you before we start with specific questions about how the film became a reality, knowing that some of those underwriters were required to get it done.
Sure, thanks, Ashley. And you know, this really started with UNM School of Medicine. And I just want to let you know, this film, you saw a lot of New Mexico in this, and I'm very, very proud of that fact, because the School of Medicine, Dr. DeHorty, Dr. McCabe, several other people from here in New Mexico were integral to the creation of this film. It's a national PBS special. We're in over 35 markets across the country, 6 of the top 12. We've done just about 30 of these Q&A and screening sessions all over the country. We do University of Florida tomorrow, but it all started at UNM. So go Lobos. I think that's great. And the way it started, Dr. DeHorty took me to lunch in 2017, way before we could even consider there would be a pandemic. And he said, you know, we did this study. He had a group of students from UNM who had done a study on the last 90 years of the cinema's portrayal of vaccinations. And what they found was, and it's probably no surprise, but what they found was that way back 90 years ago, people who created vaccines and administered vaccines were the heroes. You know, the Errol Flynns were the ones who saved the community or the state or the world from some horrible disease. And in the last couple of years, as you know, you look at a movie like Legend, where people get injected and they turn into zombies or whatever it is. The perception that has been portrayed by cinema and television has changed pretty dramatically over the last 90 years. As we talked more about it, as we started doing what we call think tanks and meeting with physicians and parents and a number of people here and around the country, it was clear that the misinformation that was out there was really not only bad but dangerous. So we started in the project in 2017. We did a lot of research leading up to it. Admiral Schweitzer became involved and introduced us to some amazing people. And of course, Dr. McCabe gave us guidance. And we had a tremendous amount of information that we needed to distill down into 60 minutes, which hopefully this is the start of a good conversation about all this that will help people down the road for our state and across the country as well.
I just want to jump in and add, part of what made it even more special was in New Mexico. For New Mexico, they deserve a lot of credit, is even the PBS station. I understand now the process that to get onto the PBS station, and Chris's reputation and just his previous accomplished work was something that really helped get them behind it totally, and so that they're pushing it. It's getting pushed out across the nation. So, yay, New Mexico.
Yes, and we know that you, several of you did join a panel on campus with the pharmacy school recently. So we know we're pushing it here through the University of New Mexico, and really happy that you all were able to join us. It's a great story and good to know that history. Thank you for sharing it. We did receive some questions ahead of time that are specific to the lives that many of our School of Medicine community members are living. And we have our alumni as well as community members who've asked questions. I'm going to start with one here that is specific to pediatrics. So possibly Dr. DeHorty, you might want to be the one to answer, but anyone, of course, can jump in. Some kids, of course, and we did see some of it in the film, they have strange side effects to vaccines. And so this individual asked if you could talk a little bit about mild side effects of vaccinations versus some major side effects that parents should be aware of, and to be prepared for identifying the difference between something minor and something major.
Yeah, that's a great question. So I think, first off, vaccines are incredibly safe. They're one of the safest things that we do in medicine. When you think of drugs that we give and tests that we do and surgeries, the vaccine is one of the safest things that we do. Far and away, if there's going to be any sort of problem, it's going to be something very mild and predictable. So there might be some pain at the site of the injection. You might get a little bit of swelling and redness there. Nothing to be concerned about. That can be dealt with a cold compress, some Tylenol or some Motrin. With these COVID vaccines, as you know, if you've been vaccinated, you often get or can get a mild flu-like symptoms that can occur, particularly after the second shot. And it lasts about a day or so. Again, you can take some Motrin or Tylenol for that. You are not infected with the virus at that point. And most of the time, it doesn't cause any real problem. So that's far and away the most common things that you would see, which pale in comparison to the dangers posed by an actual COVID infection. The second part of the question was major problems that might occur. Again, to emphasize, incredibly rare. On the order of maybe 1 in every 40 or 50,000 kids that gets these vaccines, you might get some mild inflammation of the heart, which is temporary. Typically goes away in a day or two and doesn't, as far as we know, cause any long-term problems. Now, it might be scary for some people to hear that, but I would bring up 2 points. Very rare, again, 1 in maybe 30 or 50,000. And secondly, the same problem can occur with actual COVID infection. It can occur much more commonly, about 300 times more commonly with actual COVID as opposed to the vaccine. And unlike the vaccine side effects, the heart problems with COVID are much more likely to be severe, dangerous, and potentially land your child in the hospital, or potentially could even be fatal and kill them.
Thank you for that answer. I know as a parent myself, those are questions that I definitely think of. And another that came up that I think parents think of is this question: are the ingredients in vaccines safe? Aren't alumni and mercury dangerous? Or aluminum
Absolutely.
and mercury
Aluminum and mercury,
dangerous?
yeah. So also another great question. Anytime you're putting something into the body of your child, it's totally natural to want to make sure that it's safe and nothing more than what is absolutely necessary. So these messenger RNA vaccines, the Pfizer and the Moderna, are really what I would call clean vaccines. There's not much in them. To give you some perspective, back in the old days, which actually isn't that far away, but in the 1980s, we used to use something called a full cell vaccine for whooping cough and tetanus and diphtheria. We would actually inject a killed version of the entire bacteria directly into your body. Now we've come all the way into 2021 with this messenger RNA technology. We just take a tiny little piece of the genetic material of the virus. That's like the blueprint for a house. Except instead of an entire house, we're just taking like the roof. So we're just taking a little piece of a protein, just like the roof of the virus, not capable of causing infection. And that's what we're injecting in, okay? So just as a house cannot stand with only a roof, the virus can't stand or survive with just one little piece of protein that is being encoded for. And so these are really clean vaccines. And aside from a few minor ingredients that are in place, in addition to that, they really don't cause any problems. The aluminum and the mercury have gotten a lot of press. They're not in this vaccine. In fact, aside from a few flu shots, we don't use mercury in any vaccines anymore. And it's been a couple of decades since mercury was actually in shots.
To know, along the same kind of pediatric train of thought, we do have someone who is a pediatrician who wrote the biggest concern that they hear from parents is a fear of myocarditis, if I'm saying that correctly. Can you review the latest evidence on a connection between the vaccine and myocarditis and some talking points to use with parents? Right now, this person tells them of the risk of developing it, that it's higher, like you mentioned earlier, with the actual illness than with the vaccine. But do you have anything else to mention?
Yeah, we were talking about that a little bit earlier with the heart problems. Myocarditis is simply a medical word for some inflammation or swelling of the heart. It, as we said before, it give you some numbers. It's about 300 times more common with actual COVID infection than it is with the vaccine. It's much more serious with COVID infection with the vaccines. We haven't had anyone die from this with the vaccine. Most of the kids, if they get it at all, will be sick for a day or two. Most don't even come in the hospital, and many don't even know they have it. However, we've had children die of this when they actually get COVID. And so I think, the underlying problem here, I think, is very understandable. It's fear. It's a new vaccine. You hear this thing, it sounds very scary. The heart gets inflamed, totally understandable. But I think the take-home message is that this is incredibly mild and incredibly rare compared to what might actually happen if your child got a COVID infection. So another analogy I like to use, an astronaut, it's better to have the astronaut practice on a flight simulator before they actually go up in a spaceship. You don't want someone learning to fly a spaceship for the first time while they're in space. And so the vaccine is like a flight simulator. It's a way that your immune system can practice killing the virus and getting prepared so that when they actually see it, they're ready to go. If your child is unimmunized, they may see an actual COVID infection for the very first time with no preparation. So that's like putting your child in a spaceship than having them try to land it back on Earth with no practice in a flight simulator. Better to get your immune system a chance to practice with the vaccine so they're ready to go.
We can
Thank
tell
you.
you've got that story down well for the kids.
And we're so appreciative. It's very relevant right now with parents like myself making decisions about vaccination for their children. We had someone bring up specific to children again, and then we'll kind of pivot from there. Is it wise to vaccinate children and interfere with their robust T-cell response?
Yeah, so another good question. Kids do have a developing immune system. And so just like their body is growing, they're getting bigger and taller, and their brains are growing, their immune system is growing too. I would actually say, though, that as opposed to interfering with the immune system, I think vaccines help a child's immune system. So you are similar to the way a child goes to school to learn how to read and to write. Their immune system goes to school on these vaccines to learn how to respond to things like polio and tetanus and measles, which we don't see anymore. So you're educating your child's immune system as they go throughout life and get these vaccines, and COVID's going to be no different. We want their immune system to be studied up and ready for COVID when they get infected. So I don't actually think it interferes with the child's immune system development. I think it's an integral part of their immune system development.
Well, thank you, Dr. Doty, for those insights for parents. We have some questions that came in about when individuals have already had COVID. And so I'm not sure who would like to take this question, but basically the question is, what's the benefit of getting a vaccine or getting the booster if you happen to contract COVID and hasn't your body already built the antibodies that it needs?
Dr. McCabe should take this.
So there are several issues with this question, I think. And I had a personal experience where this came into play. That particular question is, the person did not want the vaccine because the relative had already been sick with the illness. And so my question immediately was, how long ago was that? And the answer was about a year, a little bit more than a year ago. I said, oh, okay, well, maybe the Alpha variant had come into play at that point. And what we're dealing with now is the Delta variant. So it depends when, the issue is, when did they get the infection? So that's a really important question. I think the other issue is, when you get the vaccine, and let's say you do become infected, the likelihood that you are especially going to get severe infection is very, very low. If your infection, the natural infection, occurred more than 6 months out, the time frame varies, 4 to 6 months, your immune system is beginning to diminish. And so you're likely to then again become infected. And the severity of the natural infection is so much greater than if you actually got the vaccine. So actually, there are several reasons why it might be, even if you got the infection, several reasons you should get it. Now, the other important issue here is, when they looked at someone who had the infection, just a natural infection, and they got a dose of one of the vaccines, their immune system just kicked in beautifully. They just were really, their little antibodies were just floating around in their bodies and fighting off all the different antigens. And so it actually gives them a whole lot more protection also. So it does make sense that even though you've had the infection, that the benefit of the vaccine really is there. So
thank you for that answer. What effect does vaccination have, and this kind of ties into what you're saying, on the future responses to viruses specifically?
I think Dr. Jordy, you kind of answered that, didn't you?
Yeah, it helps the immune system. So when you get a flu vaccine, which is a virus, or a COVID vaccine, which is a virus, or measles, there's a lot of viral vaccines. It helps your immune system prepare for the day when they actually see that virus and gets it ready. So they're studied up and ready to go. So it actually helps that immune system and that immune response develop.
Yes. And I saw that in the film as well, a good answer to it. Something we hear often, I think a question that came in was, do vaccines cause autism?
And I'll take that one.
Yeah, that's kind of
Sure.
in your lane there.
Personal area of interest of mine, no. So just I'll say right out, flat out, unequivocally, do not cause autism. And a brief background on how that started. It's really almost an urban legend at this point. There was a physician named Andrew Wakefield who was a surgeon. He was actually not an infectious disease doctor or an immunologist, who performed some unethical research where consent was not reliably obtained on children. He recruited the kids from a children's birthday party to take part in the study. He had arranged for financial kickbacks from a malpractice attorney in exchange for gathering data they could then use to sue the measles manufacturers. As a result of all this unethical behavior, he was stripped of his medical license, and he had actually falsified laboratory data to support his findings. So the journal which published that, The Lancet, when all this came out, retracted the article, which basically means that you can't find it anymore because they said it was so unreliable and falsified that they removed it. And so you really can't find it anymore. That's it. That was the entire basis of it. And it sort of took a life on its own, as Chris's film had that beautiful quote from Jonathan Swift about falsehood flies and the truth comes limping after. So that was the falsehood flying, was that article, and the truth still limping after 2 decades later. But short message, no.
Thank you. I think this is one of the more interesting, most interesting, questions of the evening. And one that I don't know that I understand. Why are so many doses needed for some vaccines and not for others?
Yeah, I could hit that one.
You can take that one because so many kids have multiple doses. That's like,
Sure.
Yeah, and it's another great. These are all great questions.
It's a really great question.
It really has to do because we have different diseases, different vaccines for different diseases. And some vaccines produce better immunity than others. And a great example is whooping cough. So whooping cough, we do have a vaccine for. However, just because whooping cough is whooping cough, the bacteria that causes it has actually very craftily begun to develop resistance to the vaccine. So it started carrying genes that will make it resistant to the vaccine, the same way that antibiotics can have resistance to certain bacteria. So we have to give booster shots for whooping cough. So every kid gets their 2-month, 4-month, 6-month whooping cough shots. They get another one when they turn 11, right? That's just the way whooping cough is. And so that's an example of why in a perfect world, we'd have a better vaccine for whooping cough. The one we have is pretty darn good, but it does require some booster doses to get that immunity going. Contrast that with measles. Measles vaccines, you get 2 when you're a kid, you're done. So you could be 97 years old, you don't need a measles booster. And it's, again, just the way the vaccine is. Some viruses, based on the way they're structured, it's a little easier to create a vaccine that's very effective. Some bacteria and viruses are a little sneakier. They mutate easier, and so you have to have booster doses. And then you have another scenario with like the flu and probably with COVID is they actually have different versions of the virus running around. So it's almost like a wolf in sheep's clothing where it's a different virus. It's the Delta, it's the Omicron variant. It's a different version of flu. And so there you're actually having a shot against a slightly different version of the virus, whereas measles hasn't changed much in thousands of years. It's the same virus.
Ashley, I have a question for Admiral Schweitzer, if I may.
Yes, please.
And thank you, Admiral, for spending time with us. You're busy, and what a great thing to have you here. Looking at the national perspective, there's a lot of distrust of the government, and Dr. McCabe talked about it in the film. How is the government? I know you're still dealing with all sorts of things at the Public Health Service and through the Surgeon General's office. How do you overcome that distrust? How should public health officials, doctors and others around the country address this mistrust in a way that's effective and meaningful?
Well, thank you for that question. And I should probably, Dr. McCabe really highlighted it in the documentary when she talked about the patients. It's not just the Native American patients, but it's a lot of all patients. They trust if they have a provider. There are certain people they go to those places where they're trust. And I think the government realizes that. And I know the Surgeon General, they put out actually a toolkit on misinformation here just within this last month. I'll put the link in the chat, I guess, here. But it's really a lot about in the community, really trying to encourage people to go and try to educate them a little bit about misinformation, and also to go to these places where you have reliable people to give you information. And the providers are definitely the physicians, nurses, with the folks that you go to for a long time. We need a place to go where we can get reliable information. And so it's really up to all of us in our communities to do our part to be able to do that, because a lot of this is going to be community driven too. And so they realize that. You see them, well, not in every area, but you see in a lot of areas, they're trying to let the community kind of step up and do that, because they know it's a liability for the government to come in. And you can see just what's happened with when they say the mandate, everybody gets all excited, but that's not really the intention overall. They want the communities to kind of step up. And you'll notice across the country, some of the communities, some of the states have done a really good job. It might be by county, of stepping up, and it's leadership. A lot of it's related to the leadership and people coming together, working come together to make these policy and try to make changes there in their communities. And I know you may want to add some others, Dr. McCabe, too. You actually hit it right on, because that's really what the main goal is. We have to go, where do we get information? There's so much out there, and people are doing their own research. And research. And is it a reliable source? Is it credible? And I'll put the link in the website.
Thank you. Dr. McCabe, did you want to add anything to that before we moved on to another question?
Yeah, if I could just hear Chris's question one more time, so I make sure I'm answering.
It was really, how do you deal with the government distrust? How can you address, whether if you're a doctor and you're dealing with it, or with your friends or colleagues and that sort of thing?
Right. Yeah, I think that's just a very, very, very critical question, because, and I'm going to take American Indians, Alaska Natives as the example here, but it has been seen with our Black population, with our Hispanic population. And this truly is a multifactorial issue. And it starts right from the top, and that is structural racism. That has to get addressed. If that's not addressed, communities can do everything they possibly can to address the issue. But unless there is a change within the structural systems throughout our country, especially in healthcare, the structural racism in healthcare, I saw the system. I know it's there. If that doesn't get changed, if the US government doesn't change their system, that mistrust is going to continue. If organizations don't change their systems, that mistrust is going to continue. If individuals within those systems don't change their approaches and their thoughts, that mistrust is going to continue. So, I think honesty is a good beginning, just being right up front honest with populations, paying attention to their needs, taking care of their healthcare needs, showing that you really care. I mean, those are very specific to the individual providing care to these populations. And the other thing that came out of a study out of the Urban Indian Health Institute out of the University of Seattle was anyone interacting with groups that have been marginalized, you have to acknowledge the historical trauma that has occurred within these populations. You have to acknowledge it. Any provider has to acknowledge it. So what does that mean? That means providers have to know what that is. They have to be educated. So that's another component to all the different organizations throughout the country. They have to be educated about historical traumas that have occurred in our marginalized populations. So it really is multifactorial. I think communities are making great efforts at trying to address issues, but unless the other part of the system changes, not much is going to change.
Thank you so much for that question, Chris. It's an important discussion in this time and in our state right now. And so I really appreciate the question. And while we were visiting a little, we finally have a couple questions coming in from our live Q&A. Dr. Doherty, you are tech savvy, so you kind of answered some of those questions in the chat, but for our recording and for those who may not be able to see the chat, I'm going to ask that question and give you a chance to reply via video. So we received a question for people who have had a breakthrough COVID case, maybe greater than 6 months after getting their second vaccine, when would you advise that they get a booster vaccine?
Yeah, I will say there's not a lot of data on that. As Dr. McCabe said, it's still beneficial to get an immunization. Some experts have been recommending waiting at least a couple of months or so, 6 weeks, to make sure that you're fully recovered before you get a booster dose. I think the big overarching concern is that if you assume that you're immune and you have some new variant circulating or something like that, and you never get that booster dose or get the vaccine in the first place. Another point to bring out is MIS-C, which is multi-system inflammatory syndrome in children. That is a little different story. That's where your immune system goes haywire after you get a COVID infection and your organs shut down. It's kind of like a circuit board just blowing up. If someone has had MIS-C, then you have to have some discussions with your physician. And that's a different scenario. The CDC is still thinking that you can get vaccinated, but you need to wait a little bit longer, case by case basis, and you have to have a nice discussion with your provider, your medical provider, whoever that may be.
Thank you. A couple other questions that have come in is, can you explain the relationship between vaccines and deaths in the very elderly? Who might want to take that question?
I don't know what the relationship is between vaccines and death in the very elderly, Pam.
I'm not up to speed on that.
Is there a relationship? I think what they're trying to say is that maybe death rates and vaccines in the elderly is some issue, but I just want to talk about this just a second. The whole thing is about misinformation, right? And misinformation takes a variety of forms. I noticed in the chat, Elena had a very interesting point, and I think you read it, Dr. Doherty, about she said that's not the full story that you're giving on the autism thing. Here's the problem with the media. And I've been a part of the media for, gosh, way too long, 40 years. I was a news reporter. I've done all these different things. The problem is, and I describe it as truth versus honesty. You can be truthful, but it's not the full context. It's not the full honest part of it. And when you get to honesty, it's not black and white. There's a lot of gray and it takes a lot of explanation. As we explain these things in the Q&A, you could pick out one little piece and go, oh, wait a minute, here's what he said. And as an example of this, I was talking early this morning, Admiral Schweitzer and I were in a meeting with some people, and I was saying I was in Georgia. And there is no pandemic in Georgia. It's just amazing. Nobody's wearing masks, nobody's vaccinated, nobody cares. Now, that's not necessarily true, but it looks a lot different than I went to New York. Totally different look. Everybody's wearing masks. You have to show your vaccine card to get into a restaurant. It's a whole different kettle of fish. And one of the gentlemen that we were talking with out of San Francisco said, I'm going to look up this information. I'm really curious as to what the rates are, right? So let me give you two pieces of information. You decide which one to use. If he said, you're actually less likely to catch COVID in Savannah, Georgia. He's accurate. That's actually truthful and accurate, right? Except here's the bad news. When you work out all the math, the death rate in Savannah, Georgia, where I was, for COVID patients is about 5.5%, the death rate. In New York City, the death rate is 0.7%, right? And that's likely explained by preventing serious outcomes. That the vaccination rate in New York with at least one shot in New York County is way over 90%. And in Chatham County in Savannah, the vaccination rate is less than 60%. So the death rate for patients is higher. Now you can say you're less likely to catch COVID in Savannah, but you see how it gets real tricky when you get into all these little detailed things. So what we were trying to say in the documentary is, as you see these headlines, they're making headlines. Their whole goal is to get you to click. That's how they make money. It's clickbait. You've heard that term. Same thing with really news stations, local and national news stations. They're there to get audience members. The more eyeballs who watch the news, the more they can sell their ads for, right? So even in mainstream media, the top of the news may not be the most important thing that happened today. It's the thing that's going to get the most viewers to watch. So we have to be very careful about all this stuff. I get worked up about this, but it's a really interesting, we have to be media savvy in a lot of ways and take things, as Dr. Southwell in the documentary said, take a breath, do some research before you share things. Make sure what you're sharing. It's really important. I'm sorry, I got off topic, Ashley. I get all worked up.
Yeah, just adding to that is I've been out helping in the Medical Reserve Corps where I live. I've been just building into the conversation as I'm chatting with folks. So where do you learn? Where do you find out information? Because I usually ask them a little bit if they have questions. No, I did all my, well, where did you do your research? It's really fascinating where people get the information. A lot of it is not from their physicians. It could be from family members. It could be from the news. It's from social media. It's from all different places. Now they came in to get vaccinated. So whatever they were reviewing, it got them in there, but it's just, it's very, very challenging. So I built that into every question, every time I'm visiting with somebody, just where they get their information and find out if they have a regular provider, to try to get them plugged in so they can get a good resource there if they are really concerned.
Thank you both for that. I know some of the clickbait and information that I've seen on social media has to do with the new variants. And, there's, something new about that every day. And I think that's probably what someone saw that caused them to ask this question, which is, have current COVID vaccines been modified to address new variants, or are boosters that people are receiving the same as before?
Dr. McCabe, you seem to be up on all the latest stuff.
They're the same as before right now, but they're working on new ones. So, but they're not ready yet.
Yeah, I think that's the data that I saw, is that Pfizer and Moderna both particularly are paying very close attention to the Omicron, or Omicron, however you prefer to pronounce that, to that variant, and are beginning to think about changing their vaccine to hopefully get better control of that. But at this point on the Omicron, we really don't know. I mean, I think we're not going to really see much data for another maybe 2 weeks on how severe these infections are.
I do know that the labs, for those that are in the medical, the labs are starting to adjust their tests, because they may not even been testing. So they're now, so we need time for them to collect all the lab data.
Right.
You know, and I've also heard, and I'm curious as to your response. I've done a lot of research in this, and obviously we had some experts. Somebody said to me the other day, you know, these mask things, yeah, I just don't know if they work. And it was interesting because he said, well, you know, and Elena, you mentioned it in the chat too. Florida has a low rate and they're not wearing masks down there at all. So maybe the masks aren't working. What is your view on that, Dr. McCabe and Dr. Doherty?
On the masks?
Yeah.
Yeah, I mean, if you, even back in the 1918 Spanish flu, some of the first measures that they took to reduce the spread was to wear masks and physical distance. And a recent study just came out that looked at the type of mask that seems to be the most effective. And that is that surgical mask. And that was even better than the cloth masks that were being pushed earlier. So, but there definitely is protection against transmission when someone wears a mask. I mean, and we see this over and over again. And again, I want to, as I mentioned the other night, masks are critically important, but so is hand washing, so is physical distancing. All those measures, despite our vaccination rates that we're doing, we still have to pay attention to all of that. We really have to pay attention to that. The other interesting thing now, I don't know that this has been associated with that, all those measures, prevention measures, but our flu rates went down during the 2020 season. And the question was, it begged the question, was it because we did wash our hands, that we physical distance, that we covered our mouths? Was it because of that? I think there were too many confounding variables to really make that final statement, but it really did beg the question, was that what made a difference? The other rates that dropped, and I think Dr. Doherty, you can correct me if I'm wrong on this, are the RSV rates during the pandemic. Now and again, it goes to viruses and infections and transmissibility. But the interesting thing is that the RSV made its appearance again in July, I believe it was, of this year. And that was sort of, according to the pediatricians, a little unheard of, because that's typically a fall, winter, late winter infection that occurs, and it can be very serious in our young and in our elders. So the question is, and again, Dr. Doherty, maybe you have an answer to that, but why did that happen? Why did RSV come up in the summer when before it was really a winter? And during COVID, the rates dropped. So that's another interesting thing. Getting to your point, Chris, about masks and all the other prevention measures.
Yeah, I would agree with that 100%. I think the flu and RSV data in the last 2 years is one of the most fascinating things I've ever seen in my career. I was just looking at it today and I didn't believe it, but in January of the year before COVID hit, we had about 25,000 cases of flu coming in per week, lab confirmed. A year later, with everyone, as Dr. McCabe said, masking and washing their hands, 25. Not 25,000, not 2,500, 25 cases. So there were literally like 1,000-fold or a 10,000-fold reduction in flu cases. And RSV, our hospital is jam-packed with kids. They're literally overflowing with RSV. We had none. And it was the most bizarre thing I'd ever seen. And then they popped up in July. And just as you said, there was so many moving parts. Kids were out of school, wearing masks. Everyone was washing their hands like never before. And I think it all kind of played a role. What probably happened in July and August when we saw RSV, kids started going back to school. And Albuquerque public schools opened up and kids started playing soccer and things. And that may have had something to do with it. And maybe there was a little bit of fatigue, mask fatigue, hand washing fatigue. And you may have seen that. But I had never seen a single case of RSV in July my entire career until this year.
What is RSV? I apologize.
Yeah, RSV is respiratory syncytial virus. To an adult, it causes the common cold. To a child, an infant, it can actually kill them or send them in the ICU. It's a very dangerous virus in little babies. In adults like us, it would cause a cold. Probably in the elderly too. I think it can.
Yes. Yeah, absolutely.
You know, one of the things, and Admiral Schweitzer, you may react to this. Admiral Schweitzer gave me a book called Premonition: A Pandemic Story. It's a nonfiction book, and it's pretty incredible. It's sort of the year and a half leading up to the pandemic, and what we did as a country, and how that sort of started, and how we addressed it in a variety of ways. It's really apolitical, and it just explains how everything went along. But what struck me about the book, and this is something you could address, Admiral Schweitzer, is in order for the government to respond to pandemics, they have to make decisions before all the data is in. Because if you wait for all the data to get in, or at least this is what I got from the book, if you wait for the data to get in, it's already out there. It's already passed. It's like the Omicron thing. We're responding to it now. We don't know exactly how much is here and what's going on, but we have to make decisions based on community health issues prior to all the information and data being out there. Would you agree with that? And that's a difficult thing for the government to do. And then people go, hey, how come you did this and it didn't turn out? And it's like, well, then we got more data and we changed our, course.
Yeah, that's actually one of the things that it's a little bit confusing. And I visit with people about this all the time. Is you're getting data in, you're making decisions on that data, but data, as you get more in, it's going to change. And so the answer is going to be a little bit different. And we just need to be prepared that it's going to be evolving. And so it's not like we're changing our mind. This is the data at this point, this is what it's saying. And then as you get more in, okay, now we know a little bit more. Because that was early on. People were every single little part that we were being told to do, there was data on it, and then it kept on getting tweaked and tweaked and tweaked and changed. What I was going to say is the common cold during that same time went down too. I think the CDC, besides looking at flu, the common cold, and I know that all of us, I'm one of the ones that gets a cold every year, and I didn't get a cold. It was so great to be healthy all year. So I was pretty happy. And lots of people I know were in the same boat.
Well, Chris, we've gotten through the questions that have come in both ahead of time and in the Q&A, but one question that lingers is for individuals who want to share these resources, individuals who want to watch the video again and make sure others are aware, where can they go? What resources do you have? And we can put that in the chat when you're done talking.
I just put it in the chat again. And listen, we have a challenge for all of you who are here tonight, and we appreciate it so much that you spent the time. I know everybody's busy and it's late night. But you can get the documentary, share it with your friends. You can get all the, we have, there's 35 what we call lift out videos. They're short. They're 30 seconds to 2 or 3 minutes. When Dr. Doherty talks about the misinformation around flu vaccines, it's about 1:30. When Dr. McCabe talks about how long the mRNA vaccines have been in existence, it's not warp speed. That's about a 2-minute piece. You can find all these pieces and you can share them. You can download them. They're free. You can use them on your social media. You can give them to your colleagues. You can give them to your patients. And there's 35 of them, and they're listed out so you know exactly what they are, who's in them, how to use them. You can download them. They're also done with Spanish subtitles. So that's helpful, especially here in New Mexico, I think. And there's a curriculum guide if you want to use this with your faith community, small groups. PTAs all across the state are using it now, along with the curriculum guide. It's sort of a turnkey thing. All of it's free. All of it's there at themisinformationvirus.com, themisinformationvirus.com.
And there's a 30-minute version too.
Yes, there's a 30-minute version. If you have a service club and you got an hour, show the 30-minute version and have a talk afterwards. Great.
Mm-hmm.
Thank you for making those resources available. And we'll put that link in the chat again for anyone who isn't able to see it. And I want to thank I want to thank everyone who's here on the panel today for spending that time. As Chris said, it is a late evening and you all have been busy. You all have done many of these events and spent time educating the public and your colleagues. And I know I learned a lot. And so just want to extend my gratitude on behalf of the School of Medicine and on behalf of the community, the Albuquerque Public Schools community, the School of Medicine community, and the Albuquerque Academy community for the time that you've spent with us. We appreciate it. And for all of you who are watching, please reach out if you have further questions. We'd be happy to pass that along and make connections for you. The Office of Advancement and Alumni Relations can be a contact for you as well. We're going to thank everybody with that and let you head out. We're going to leave the screen open for just a minute if anybody else has lingering questions. But again,
Ashley, a quick question. Somebody wondered if they could get a hold of this whole thing, our conversation that we just had in that. Is that available?
Yes, absolutely. Thank you for bringing that up. We are recording this portion. Of course, the film, as you mentioned, is available on the website, but this portion, the panel, will be available on the UNM School of Medicine's website under the Community Lecture Series tab, and we'll make that available. We'll also send a recording of just the panel to everyone who registered. We had well over 100 registrations for today, and as we know, not everyone's able to make it, so we'll make sure everyone who showed interest has a chance to watch the recording.
Thank you so much, and thank the School of Medicine.
Absolutely. Absolutely. Our pleasure to have you all and to see many of you again, if it's been a while. Everyone take care, have a good evening, and thank you so much.